As the heat of the summer begins, so does mosquito season. And in Los Angeles County, health officials have confirmed the first positive sample of the West Nile virus in the area. The sample was taken from a mosquito trap. For more on this, let's bring in Dr. Amesh Adalja. He's an infectious disease physician and senior scholar at the Johns Hopkins Center for Health Security. Good to see you in studio.
Thanks for having me.
So, mosquitoes are terrible. I like all living things, but mosquitoes seem to be a scourge on humanity. Explain what the West Nile virus is and how it spreads, particularly with mosquitoes.
So West Nile is a virus that kind of maintains itself between mosquitoes and birds. And what can happen is humans get into that cycle and get bitten by a mosquito that carries the virus. And about 80% of people have no symptoms at all. 20% or so might have a flu-like illness, but about 1% or less than 1% can get a pretty dangerous infection where the virus travels to the brain, and that's where we worry about what's called encephalitis and seizures. People can die from that. That's the thing we're trying to prevent.
Yeah, I was sort of surprised to hear that because, you know, every summer we do talk about West Nile virus, and I kind of just consider it more of a nuisance than anything else. But then to learn that you can actually die was a whole another level. We don't have a human vaccine, right?
Right. There's one that was in development, but it's kind of sitting on the shelf. It didn't get fully through development, so we don't have any protection other than avoiding mosquitoes.
So then, like, what do you do if you have contracted West Nile?
It's supportive care in the hospital. It can be very challenging. So it's being in a hospital, often in an intensive care unit where you're getting a lot of monitoring done, but there's no specific antiviral. There's no specific thing that you can really do for West Nile. So it's something that you want to avoid getting, and it's something that we would like to see that vaccine come off the shelf and actually become a commercial product.
Right.
So what can people do to avoid getting the virus? I mean, is it simply
avoid mosquitoes, I guess,
yeah,
right?
like spraying yourself with DEET?
Yeah, exactly. It's using mosquito repellents, avoiding places where there's known to be mosquitoes. When you're inside, using your air conditioner, because mosquitoes don't like air conditioning, so they will not come into your house if that's the case, if the air conditioner's on. Wearing clothing that's kind of covering up all those exposed areas where mosquitoes bite, but that's very hard when it's as hot as it is. So it's very difficult. Remember, mosquitoes are the most dangerous animal on the planet, and there's a reason why, because they can easily bite you even with your best precautions.
Let me ask you, as a parent of a 15-month-old, how much of a risk, greater risk are children, young children?
So usually with West Nile, the more severe cases are the extremes of age, especially if you're older.
Is that right?
Yeah, and that's true for many infectious disease. Very young, very old, that's where you see the bulk of severe disease. It's very hard with a child because you can't keep track of, they're not going to be swatting away mosquitoes. They may not even notice a mosquito, but that's why mosquito diseases do take a big toll on the very young.
And I know this might seem like a dumb question, but you can't tell which mosquitoes are carrying the virus. Like they're not prone to certain types of mosquitoes or anything along those lines.
Well, there are certain mosquitoes. So it's the common household mosquito that actually spreads West Nile. It's got this fancy Latin name called, it's a Culex mosquito, which are different than the mosquitoes that spread Zika. Those are Aedes mosquitoes, which are different than the mosquitoes that spread malaria, which are Anopheles mosquitoes. So each mosquito can have its own kind of characteristic infectious disease. You could tell them apart by eye, but if you're a trained person to look at them, but
I'm not looking at them that long.
Yeah.
Wow, that's fascinating.
Yeah, that is really interesting. Yeah.
That's incredible.
Well, Dr. Amesh Adalja, thank you so much.
And all three of those species are native to, or not native, but are found here in the United States.
Well, Zika's been turning up here.
Yeah, they are. They are all found in parts of the United States. Not everywhere, every place, but each place has its own kind of place where they're found.
But it seems like West Nile in particular, you pretty much find across the country.
Yeah, almost every state has reported West Nile cases, yeah.
Okay, Dr. Adalja, thank you so much.
Thanks for the great news.
Yeah.
As we get ready for the summer.